Hi, this is Dr. Ginger Lee. I would like to discuss with you today and demonstrate to you the use of the Hivamat machine. You might have heard or seen or just hear us talk about the Hivamat and what is that. And it's a machine made in Germany for many years. They've used it over there for many years. I actually started to use this machine, say about, I've had my practice for 17 years. I probably used this machine for about 15 years. So the effect of the Hivamat starts from the skin area and it penetrates all the way down to a depth of 8 centimeters. But mainly the Hivamat is a deep oscillation. It goes about 8 centimeters deep into the tissue, which is about 3 inches. It goes throughout the connective tissue, blood vessels, fatty tissues, and it helps to stimulate activities all throughout this depth of tissue. Mainly it's electrostatic signals, and it feels very relaxing for many people who are very hypersensitive to pain, and you don't like to be touched, you don't like to have people massage you or squeeze. It's very painful for you. This is a very light touch. I just wear gloves and then I just touch my arm like this. I touch the patient's arm, and you don't have to squeeze, and you're getting that effect. It feels like static electricity, but you don't get shocked by it. Okay, so it helps to produce a deep acting effect at all tissue levels of about that thick, and then it reduces pain, inflammation, absorb the edema. It helps in wound healing and lymphedema, and it helps a lot of chronic but inflammatory pain, anything that you have swellings or inflammation of the tissues. So I'm going to demonstrate that with you. The patient will hold this, and then mainly you can have the patient hold in the arm or even in between their toes, as long as they have that contact. So I'm going to have her hold it over here to be out of the way. We don't need that anymore, okay? And then for me, I just put a patch over my own skin, and that's going to form the circle as long as she's holding that. I have this around me, I don't lose it, and then I touch her, and then she starts to feel the electricity, and you start to feel the vibration. Can you guys hear that? So all I'm doing is I'm just touching her, but by touching her I'm forming that circle of contact, that electrical connection, and I'm just moving up and down in any area that she feels pain. So let's say if she has arthritis and there's all that joint pain around the hand, it's like that, and I can just use one hand, or I can use both hands, and I alternate the top and bottom surface of the hand. So some people who have arthritis might feel very sensitive and they don't want us to squeeze or touch them because the joints are very sensitive and painful. So we just do that. And I change the mode, you know, from low to high. I can change the dosage. I can change the frequency. I can go up, which means that the impulses will go a lot faster. That's the maximum. Or I can go down low. Yep. So I'm lowering the frequency so that she can feel that the pulse would be less frequent, but it can feel like it goes into deeper depth, because the impulse is like instead of like that. Okay, so that's how frequencies work. And then I can go up in her arm if she has pain around this surface, here, back here, around the elbow, in the front. So I pretty much go anywhere that the patient tells me that they have pain. And then for lymphedema, what you do is you first activate the lymph nodes. So you start here where the lymph nodes are. Go about like 3-5 minutes. 5 minutes is a very long time. Usually about 3 minutes is good to activate the lymph nodes here. Loosen up the flow. Now the surface of the underarm can be moist, so sometimes the signal might not be, you might not feel the signal, and then in that case you just sprinkle baby powder, and that will dry everything and let you continue, and you will feel the current being strong. So I would do it here, and then I also go up to the neck and facial area where there's a lot of lymph nodes here to activate this area. And then also watch for if the patient's turning too much, they may also have neck pain. So we have to watch and be sure their neck's comfortable. Like that. How's it feel for you? And also people who have facial paralysis or hypersensitivity here, chronic pain, hypersensitive. There's another type of problem called reflex sympathetic dystrophy. It's an older term. The newer term is like complex regional pain syndrome. They have a lot of hypersensitivities. So this would be a good device for them as well. People who have Bell's palsy with facial droop, we work on, I'm going to just demonstrate to you that too. So we work on stimulating the facial musculatures here, all the way up around the eye. You can work around the eye and the eyebrows here. Are you seeing all this? And then that really helps. A lot of our patients with Bell's palsy really love this. Okay, and then back to the lymphedema patient, we would then after we've activated here and here, then we start working on the flow of the lymph. So we would go all the way from here, moving upward, and then we keep doing that, and then we come down another segment and we push that up, and then we keep going down. So you want to go from this area up, and then further down and up. So you don't start at the bottom, at the distal, the very furthest point. You actually start from the closest point, because you want to drain the lymphatic areas that are congested. So you want to be draining here first, and then you can let that clear up, and then the rest of them can flow. Otherwise you're blocking traffic here, and you can be clearing this all you want, but it's still blocked here. So you have to clear everything here first. Okay. Like that, okay? And then you can do that the same with everywhere, any part of the body. Okay? One funny thing I want to tell you is, I'll turn this off first. So when I first saw this machine, the rep came and wanted to demonstrate on all the patients, and so I just had him try on every patient that we had that day. And then I had a friend who happened to have a car run over his ankle, and he had a lot of swelling for several weeks, and because I knew him, I wanted him to come in and try, and he felt much better immediately after one treatment that day. And then another patient was my own mom, and then her knee hurt and she couldn't walk. She was hobbling. She needed us, one on each arm to help bring her into the clinic. And after one treatment that day, my mom got up and walked. So I usually don't like to try to sell any products or give patients something that doesn't work. But for me to have it work personally on my mom and my friend and then the patients that day, it really convinced me that this machine is legitimate, and so I bought it. Let's say if you just have, one-time pain or just a muscle pain, not too much swelling, that might not work for you. So I don't want people to think that, oh, I have pain, I'm gonna just go and get this treatment and I'm good. I don't want to advertise it that way. It doesn't work for all the patients, but it works on a lot of our chronic pain patients with inflammations, especially in the tissues. So if you guys want, you can come over and try. The website is www.gingerhealth.com, and we're in occupational therapy, physical therapy, and yoga, and adaptive driving. We're here all the time, Monday through Fridays. You can call us at 813-631-9700. Thank you.